Good evening, gentlemen in China, and good afternoon in Africa. Are people able to hear me? Okay, thank you, thank you, thank you. I'll quickly share my screen, uh, and yeah, so that's the screen. We'll make it full screen right now. Yeah. Uh, so Uh, basically, our company was incubated by IIT Bombay, a premier institute here in India, and our objective was to build vertical agnostic models in artificial intelligence and models that could actually be scaled up. Could be taken to the level of a software product. And I'm actually grateful to Dr. Hira for having thought that I was worthy enough to present on this forum because we sort of focus on how data can be made amenable to modeling and what it is that you should look into data to meet your goals, the decisions that you're trying to take. And somehow Dr. Hira and Santoshji thought that I was worthy enough to make a small presentation, so I'm grateful to them. Uh, so here is what the current situation is like. There is a lot of data available currently. Uh, Either a processed data from John Hopkins University, or advanced models from the Singapore University, or even a lot of I'm very happy to say a lot of the people working in the social sector have crowd-funded together to put up portals to give data about what's going on. There are almost hourly updates on many of the portals like Worldometers or COVID-19 org.india. There's a lot of hourly updates available. Now, we do not come from the medical science fraternity, but from the sheer perspective of analysis for people who are more or less, data enthusiasts. What would you actually look at? You know, so one thing that obviously first comes to your mind is the deaths per test. Deaths, actually, what is the number of deaths? Now, if you're actually trying to even work out in a refined way that not every country or not every state has been equally tested, then you would like to look at a metric which is death per test, which is the mortality metric. Now, that's the chart we have on the left-hand side. And if you look at it, it's got a fair sprinkling of countries. That's which are a fair mix. They're not easy to classify or do a pattern classification on them. So you have Algeria on the top with 6.76 in the deaths per unit tests conducted. This is into 100, by the way. I just want to give the disclaimer. It's not that six are dying for every test. It's into 100. This number is a percentage number. And you have Belgium at the fourth place. The most common heard of European countries, which are in news for a large number of coronavirus infection cases, and a large stress on their medical systems. UK and France, they come at the 7th and the 8th position. Again, you have Brazil down at the 14th, 15th, you have Ecuador. Now, the key is, how do you actually go about saying that you would like to have a more structured way of looking at your data? So one way to look at it is, say, cases per million. Yeah. And if you rank, now this is the data that we had as of the 3rd of May in the evening. Okay. If you look at the cases per million, you have San Marino at the top. And of course, we've just taken the first 15 or 16 positions to get a larger perspective of data. You have USA at the 14th position, Italy 15th, and Switzerland at the 16th position. Now, this gives some idea. Cases per million is a good metric which gives some idea about the whys of the spread, not just the hows, but the whys of the spread, like sort of. So if you look at San Marino, it's like a small enclave, almost surrounded on all sides by Italy. It's a very popular tourist destination. You go down, Spain is again popular for tourism. From Belgium onwards to Isle of Man, right until Switzerland, from the 10th to the 16th position, you have a great deal of economic engagement with the world, either in terms of the financial engagement or corporate structures that have companies over there. So you get into more of a sense of understanding that the infection, the spread of the infection, if we look with an appropriate metric like cases per million, was actually driven by this economic and travel integration. Okay. And we just quickly go down to the next slide. So now the key is, how do you actually ascertain which are the factors that are impacting the spread? I mean, if we were to say that, give us a sort of statistical multiple, that, if I take factor A and I, collect some data for factor A, well, that makes one part of the story. If I collect some data on factor B, which makes another part of the story, then what we say in simple statistical language is, can I multiply probability of infection due to factor A and probability of infection due to factor B, and then try and get a score, or can I get a rank which will say how infected a particular region or state will be. So at our end, we actually tried to identify about 4 issues which we felt were the key issues that were sort of impacting the spread. So one was economic and travel integration, international economic and travel integration of that particular nation. The other was also internal integration. In India, we found that even internal economic integration was to a great extent impacting the spread. The population densities, especially in urban areas. And fourth, what is the social infrastructure available to implement social distancing? Is the urban structure there, or the societal structure there capable of handling social distancing? So on these 4 factors, we tried to get some initial sense of an estimate. We first looked at uh, 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 Italy, and there's a small box there where we have listed the top 10 global importers, as per 2018 data. So currently the global imports are actually taken as a surrogate metric to help identify what is the extent of economic integration of those nations. And they're spread across continents, and you find that 7 of these are in the top 20 countries infected by the virus. So the extent of economic integration actually made more travel between the 2 places. There was more people to people engagement, and that people to people engagement sort of opened the doors for more communication. So let's take the case of Italy, which became the first epicenter in Europe. It had very close ties with China, to the extent that there were direct flights from northern Italy to Wuhan. uh, you know uh, the people to people and connections were very strong. Almost over a lakh citizens from China moved to Italy, work in their factories. There was Chinese ownership of Italian firms. So economic integration was, in a way, a trigger that helped the faster spread. And countries, as we go in the previous slide, sorry, at the bottom over here, each one of these has a fair degree of economic integration with some of the big superpowers in the continent. So each of the countries again, becomes a conduit for the spread. We come to India. We looked at the cases, confirmed cases across all the different states, and Here again, we tried to develop a surrogate metric. The metric was, what is the geographic distance? So Mumbai is the financial capital of the country. What was the geographic distance from Mumbai to other states, and how do their confirmed cases look like? So Delhi is, an economic epicenter in itself. Tamil Nadu is also an economic epicenter in itself. Both of them had participants in certain events that led to spreads. Uh, but by and large, if you go down the geographic distance away from the economic epicenter, you're actually seeing those many lower and lower number of cases. So that's one thing, that the distance is indeed a surrogate indicator, as to how much the spread tends to happen. We observed similar trends in New York as well, in the United States, with New York being the financial capital. We also looked at population density. Yeah. So here we ranked the top 10 states by population density in India. And the states of Bihar and Bengal, the population density is high, but their economic integration with larger cities like Delhi and Mumbai is not as high as of other neighboring states like Rajasthan and Gujarat. So though their population densities are higher, it's not as much a case that they have actually recorded that much of the high number of infections. So if there is absence of other incidental factors, then the likelihood of infection is more. But a combination of being closer to an economic epicenter as well as a high population density can, become a region for a high number of infections. Uh, so Chandigarh here, its density is pretty high, actually, quite close to the National Capital Territory of Delhi, but it has, and it is closer there, and it does have a large number of cases. Now, we actually look at the social infrastructure that's available to implement, the social distancing. Now, how does it happen? Sort of. There's very interesting data that we have about the situation in the slums. That is a lot of the lower income group residences in India. And there is a classification about the number of people whose household structures are almost about just one room. In Gujarat, it's about 69% of those people staying in informal accommodations, which is slums. 69% is one room. In Maharashtra, it's not close behind, is not far behind. It's about 67%. In Delhi, it's 61%. And progressively in other states, it's lower. And so even if the housing is informal, it's unregistered, it's undocumented housing, yet in other states, they have more rooms available. Right? So if you see for houses with 2 to 3 rooms and undocumented houses in Punjab and Haryana are looking almost at 50% of the population. Undocumented housing, but even say 4 rooms, it's still larger. Rajasthan onwards, about 14 to 15% of the undocumented housing space. Now, this social infrastructure of sorts, gives an idea of how much social distancing is possible within those states. Now, this is like turning out to a very surefire indicator. These are almost today the top 4 that you see here: Gujarat, Maharashtra, Delhi, and Tamil Nadu. If you just swap their order, these are almost the most infected states today in India. So the availability of social infrastructure and whatever local self-government interventions that could be possible to at least ramp up the social infrastructure during the pandemic really serve as an ability of a measure of their ability to help handle the situation. This list is almost mirroring the sort of list of infected states in descending order in India. So social infrastructure with surrogate indicators like number of rooms available in the house, or even the per square mile density in a slum really make a difference. Like, so for example, in Mumbai, we have Dharavi, Asia's largest slum. And on 3rd of May, the tally was about 590. This tally of Dharavi is actually more than the tally of the state of Haryana. It's like that's the sort of magnitude that gets impacted with the availability of social infrastructure. We look at two very interesting cases. Now, this is, given the fact that a lot of our COVID and Corona warriors are battling the situations on the ground, and we have data coming in every day. What do you look in the data, yeah, to say that the country, the cases are flattening, but what should decide, whether to what extent is the recovery happening place? What should be the analytic metric to assess the extent of the recovery? So if you look at this percentage size of this funnel, so I'm calling this the funnel. Yeah, so we've taken this from the worldometers.info, and they have created this mapping between death rate and recovery rate. The orange line is the death rate, and the green line is the recovery rate. On the right hand side, you have the picture for India, and if you look at it, the death rate, the orange line, like somewhere around the middle of March, was threatening to get close to the green line till the 26th March, almost to the first week of April. But after that, the gap widened, the funnel grew bigger. The growing width of this funnel indicates that the measures that the self-governments and the national governments have taken are working. And though the curve is flattening slowly, there is hope of saving lives and containing the magnitude of the impact of the virus. So the funnel keeps widening. The green line tends to grow more and more away from the orange line. Yeah. Now, on the left-hand side, we have the same picture for Italy, and this is the reason why Italy was a case of worry for a long time, almost for a month and a quarter. You can look at Italy's graph starting on the 19th of February and going right until the 3rd of April. Only after the 3rd of April did the funnel gap widen. It started widening substantially. In fact, in the beginning in Italy, the orange line, the death rate, was actually substantially more than the recovery rate. It was indeed a picture of fear. And eventually the funnel started widening. So this is also an important metric that, if the funnels widen, because most governments today are also concerned about the complete shutdown of the economic activity. If the funnel tends to widen, then the governments can go for some amount of opening up, because once the curve starts flattening, the second metric or parameter you want to look at, like, am I sure or am I confident I can start opening up? So once the funnel, the gap between the green and the orange keeps widening, maybe governments can get more confidence that they can start opening up. And that also explains, Italy's opening up of a fair amount of the country. It is this widening funnel which gives the confidence to the government. Now, I'm just trying to summarize a few methods, that we can actually make research on data stronger about. One is the pure play regression, which is similar to the Singapore University model. Yeah, it's based on regressions and it sort of tends to give a forecast. But if you want to go further, you are actually looking for a more micro strategy. You want to know what are the different factors, how they're going to impact. You could perhaps go for AHPs, which are analytic hierarchy procedures. They give a deep relational expertise between different parameters. Like, so given the sort of number of markets here in this place and the number of hospitals also available, what is the correlation coefficient I should look if I'm going to say the infection is going to spread, right? Or the infection can be contained given the fact that a certain region has both markets and hospitals, right? So those sort of detailed correlations you can actually get to the AHPs, which are the analytic hierarchy procedures. You can also use learning networks. Yeah, so these are neural networks. They are an old science. They are not a new science, but the current in the current scenario, the availability of data has made neural networks very useful. And you can actually even use neural networks to simulate how the system responds to different data inputs. So you can actually pick data from the past, like say a certain containment in movement. In some places, people were simply not allowed to leave their house, vis-a-vis in some places a partial lockdown uplift, right? You can put in the data, and a network can actually learn on its own and tell you what the future responses can be like. And neural networks can be perfected to a great degree.